What's going on YouTube? And today we're going to be going over the process of getting your wisdom teeth pulled. So I got my wisdom teeth pulled exactly 1 month ago, and I want to share my process and like react to like a video of like what it is to actually pull your wisdom teeth, and then talk over like the timeline and just share my story. Because when I first got my wisdom teeth pulled, I didn't really know anything about it. All the research I did was on YouTube and Reddit, and like it was all like scattered over. There wasn't really like one concise video. There was like videos of like people that had their teeth pulled, and they would just vlog it. And in this video, we're going to go over like the timeline. Like I said, we're going to react to a video. I'll give you some tips and tricks. I'll tell you guys my story, what I did that helped me, what I did that you shouldn't do, and we'll just go over it all in one video. So let's start off by seeing how they actually pull your wisdom teeth. And we're going to be reacting to a video of a wisdom teeth extraction. And for this video, I chose more like an animation, not like a real person, because personally I don't like seeing blood. And I don't know if y'all like it either.
The term wisdom tooth removal refers to the surgical removal of the third molars, also called the number 8 teeth. Wisdom tooth removal is also known as impacted tooth extraction. Wisdom teeth must be removed if they cause infections, develop a cyst, damage the 7th tooth through their growth, form a weak point in the jaw, endanger a prosthetic provision or make inserting a prosthesis impossible, are destroyed by deep cavities, or if a good treatment, such as a filling or root canal treatment, is not possible. We will spare.
So the reason they pulled my wisdom teeth is because they were like crowding my face, and they were like pushing my other teeth to the side and making them crooked. I really didn't have no pain. I had a little bit, but it was like tolerable. And like the dentist told me that our wisdom teeth need to be removed for like the new generation because I guess our jaws are smaller, and like the wisdom teeth they really can't fit in there, so you have to take them out so like it doesn't crowd your other teeth. That's why I got mine pulled.
Spare you explanations of individual medical terms, such as retained, partially retained, or impacted, because the treatment consequence is always the same. Depending on the position of the particular wisdom tooth, the mucous membrane must sometimes be opened more, in effect moved to the side, and more or less bone must be removed. As a rule, surgery is performed under local anesthesia and is a routine operation.
Alright, so for me, I know that you do anesthesia, but my little sister told me that she got a normal teeth pulled and it hurt like super bad. So instead, I decided I'm gonna pay. I think it was $1,200 so they could put me to sleep. I think it's called sedation, where they put you to sleep and you don't really feel much.
In the following video,
If y'all have the money and you actually need this, I would recommend it.
a minor opening is performed because the wisdom tooth is in an easily accessible position. If you'd prefer not to see any blood, return to the beginning and click on Animation. First, the surgeon obtains an overview. He palpates the ascending branch of the lower jaw and properly places the Langenbeck. Then he makes the cut. When doing so, a so-called gingival margin cut is made along the ascending branch of the lower jaw and on the number 7 tooth. You can find out more in the video entitled Gingival Margin Cut. The gums are moved to the side with a raspatory, and thus the mucous membrane, including the periosteum, is lifted off the bone. A wide raspatory is placed underneath the periosteum in order to protect the other soft parts, such as, for example, the lingual nerve, because the bone is now removed with a drill. Although the sound of this procedure roars in your head, you don't experience any pain. As soon as the bone is exposed, the instrument is changed. Now the tooth is dislocated with the turning tool and removed as a whole. Any bone chips are rinsed off, and the dental follicle is removed as well. Wounds in the mouth heal from the inside out, so you don't have to worry about a hole remaining or food scraps that might become ingrown. Finally, a saliva-tight wound closure is performed, and in most cases, an iodine strip is placed into the wound and removed the next day. As a rule,
So that can't happen for me. They gave me like stitches that like dissolve on their own, and those came off I think on like in the 6th or 7th day. So I didn't have to go back to the dentist. They just fall off on their own. One thing is they do taste really bad because all the food. So
the swelling
keep that in
increases
mind.
until the 3rd or 4th day, and then everything subsides. A week after surgery, the
Yeah,
threads
like a week.
are usually removed. There are no alternatives to a wisdom tooth removal, unless one leaves the tooth in the jaw, which may lead to the previously mentioned complications. The risks of wisdom tooth removal are relatively small with an experienced surgeon. Nevertheless, complications may occur in individual cases, possibly requiring additional measures. Every additional measure may in turn lead to further complications that may then become life-threatening in the course of treatment. At this point, we will only discuss the specific complications encountered in wisdom tooth removal. These are bone infection or osteomyelitis, injuries to surrounding structures such as the tongue, the cheeks, nerves, blood vessels, neighboring teeth.
Okay, so they said injury to like surrounding structures. I did have like a really like bad like, I think they're called ulcers. It was like almost like a cut on the top of my lip, and I still have to wear wax after like a month. It's almost perfectly healed now, but that hurt so bad. That ulcer I had in my mouth, like I would put like cream on it to not hurt me, and that putting that cream on it hurt so bad that I would like literally punch myself. Like the wisdom teeth didn't hurt, almost like at all, but that ulcer I had, I would literally hit myself to take the pain away from that ulcer I had, because I had braces on, and the brace would like be scratching upon it. That hurt probably most than any of the wisdom teeth.
Roots with corresponding consequences. Wound infections, jaw fracture, opening of the maxillary sinus, subsequently leading to an infection of the maxillary sinus, and sensory disturbances of the tongue and or lip. Fortunately, such complications have become very rare because of the positive developments in medicine in the past decades.
So all those like cases you said are worst case scenario. The only thing you really got to worry about, and I read it was only like what, like a 5 or like a 3% chance of getting it would be like a dry socket. We'll talk about more of that later in the video. But other than that, like you don't got to worry about it. If you got a good dentist and you're sedated, you really won't feel a thing. When they were pulling mine, I remember the dentist told me you might get some nerve damage like in your chin or something. I'm like, what are the odds of that? It's like not very high. I woke up and I didn't have no nerve damage, so it's not too bad. When I was sedated, I just felt like a slight tug. That's all I felt. I was out. I guess I was like cracking jokes and laughing. So, it doesn't hurt if you get sedated. I don't know if you just get anesthesia. I don't know about that because I didn't have that done. Like I said, I'd rather pay the money to not like feel the pain. Now that we saw wisdom teeth pulled, I want to give you like a quick, like brief rundown of my story. So I got my wisdom teeth pulled exactly 1 month ago, and it was like a kind of like a special case for me because when I had my teeth pulled, I had 4 wisdom teeth, the bottoms and the tops, and then I had 4 other teeth pulled because I'm getting braces. I have my tops on right now, but I had like extreme crowding. I couldn't get my braces on without these teeth getting pulled. So I had 8 total teeth removed. And like I said, I wanted to be sedated because my little sister, when she got like her teeth pulled with like anesthesia, she said it hurt really bad. So I paid an extra $1,200 to be sedated, which for me it was worth it because I never really went to the dentist. I almost like ignored my teeth. I would brush them, but they were like crooked, and so it was worth the money for me. So the day of the surgery, I wasn't really like nervous at all until like I got to the dentist's office and I was waiting in the chair. It was kind of funny because they know me there, they know my family, and I go to the bathroom a lot when I'm nervous. So I went like, I shit you not, maybe like 12 times, and they thought I left. They thought like I escaped. I was like, they called my name, and I'm like, no, I'm here, I'm just in the bathroom. So they took me in. It was like I don't know if it was a dentist. It was like a surgeon. He put me in the chair. And then, like, when you get sedated, they find, like, your veins, and they put, like, a tube to it. So, like, the sedation liquid goes into you. I lasted maybe, like, 3 minutes before before I knocked out. And I really didn't feel a thing. I knocked out, and it felt like maybe 5 minutes had passed. And then I was all, like, droopy, and, like, all my teeth were pulled, all 8 of them. And then my dad had come to pick me up. I remember I was using like my little sister as a cane because she's like 5 foot tall, so I would grab like the top of her head as a cane so I wouldn't fall over. I remember they put me in my car, and then my dad said I could put my mask on. So I put it back on. And instead of putting it on my face, I put it like on my head, which is pretty funny. I'll put a picture of that. And then the drive home, I don't really remember. I just remember they put me on my favorite couch where I watch my YouTube videos, and then I started like watching my videos, and I like kind of like almost passed out, went to sleep. And then during this time, I have gauze in my mouth. Hey, pro tip: if a dentist tells you to do something, actually do it. So this dentist told me to keep the gauze in my mouth for 1 hour. And then knowing me, I don't do what people tell me because I think I know more than them. So I took my gauze out because it was getting like bloody and it started tasting bad. So like when you get your teeth pulled, you're gonna have holes, and it's gonna bleed, of course. And you want the blood to clot, so it's like it stops the bleeding, and you don't get something called the dry socket. And we'll talk about more about dry socket. Dry socket hurts like a lot from what I'm hearing, and you don't want that. So I took the gauze out and I kept replacing it, and this stopped the blood clot from forming. And I did this like 4 or 5 times, and like my teeth were still bleeding because my dummy self wouldn't leave the gauze in there. So if a dentist told you to do something, do it, all right? And then so I couldn't sleep that night because my teeth were bleeding the whole night. So I stayed up playing Clash of Clans until I didn't stay up. I didn't go to sleep. I stayed up the whole night, and I just like actually like put the gauze in my mouth for like 2 hours, and thankfully that stopped the bleeding on all 8 of my teeth. And then the next morning, I felt a little better. Like I said, you really can't. You're not gonna be 100% the next day, but I felt better. Like I said, my teeth weren't as bleeding as bad. You can have a little bit of like a blood. What I did have, I had a lot of saliva. We'll talk more about that. Like on my timeline of my recovery, I had a lot of saliva mixed with blood, and like I had to swallow like my saliva like every 5 seconds. This is a quick little story about like my surgery. So now let's talk about the recovery process timeline. So it says like immediately after surgery, you'll have gauze packs placed in your surgical site to absorb the blood. Don't be dumb like me. Leave them in there for as long as your dentist tells you, and this will help the blood clots form in your mouth. You may need to swap them when they're soaked with blood, but if your doctor tells them keep them in for an hour, keep them in. You'll have some little bit of pain and discomfort, and that's going to be normal. You just got surgery on your mouth. So I didn't really drink many liquids because I was scared. On the first day, I drank a little bit of water, but I started like actually like eating like on the third or fourth day because I was like actually really scared of like getting a dry socket. So when you get like your wisdom teeth pulled, you're gonna have a lot of free time, and you're gonna be looking at videos how to recover faster because you really can't do like any heavy lifting. And then like I said, they're saying you could eat food, but eat at your own like comfort. Eat at your own pace. Like if you're comfortable the same day eating, you can. But I waited. And then it says, of course, do not use a straw or spit for at least 2 or 3 days. That's some good advice. Where I work, my coworkers said they both got dry socket because they both drink out of a straw. So don't do that. And then 1 to 3 days after the surgery, like I said, avoid heavy exercise. Just like relax. I relaxed on my couch because I was able to elevate my head on my couch because I had like a lot of saliva coming out of my mouth, and that actually helped a lot. Like I said, after 2 to 3 days, after the third day, I started eating like a little bit. I lost a lot of weight because I really couldn't eat. They're saying here after 2 or 3 days you can like again, this is your own discretion. Eat if you feel right, if you can. And then it says pain and discomfort tend to peak within the 1 to 3 days after surgery. We're all different. My pain, it peaked after I think it was the fifth or sixth day. I just had like really bad pain in my jaw. I took like some ibuprofen. I think it was like 800 milligrams. They gave me codeine. I don't mess with hard drugs. I only took like the ibuprofen. We're all different. 3 to 7 days after your surgery, when most of your pain and discomfort will be gone. That's kind of true. For me, after the seventh day, like all the soreness in my jaw went away. I think the 6th or 7th day, I had like my first solid food. So I took my little sister to like a McDonald's with her friend, and she gave me a French fry, and I ate it, and I was like so proud of myself because like that was the first solid food I had in a week. And then after like 2 weeks, you start feeling back to normal. It's like you won't be normal. You're still gonna have holes in your mouth. It still might feel a little tender. But for me, I went back to eating like what I normally eat on I think it was the 7th or 8th day. On the 7th or 8th day, I had a cheeseburger. I was hungry, and like that cheeseburger, it was good. It felt different, you know. Like after eating, I only ate yogurt, applesauce, and I would have like muffins with milk. I would like crush up the muffins and have it with milk, so it was like so they weren't like as hard or whatever. It was almost like a smoothie or milkshake. So after 2 weeks, you can go back to doing what you do. For me, after 1 week, I went back to work, and it's kind of like doing anything physical is gonna like hurt your teeth for whatever reason. So when I was back to work, I like iced my mouth, and like it helped. Now I could pretty much do whatever. I could go on runs, and I can go back to lifting weights. Here's another timeline. Like I said, after the first 24 hours, your blood clots will form. Keep your gauze in for as long as they tell you. Swelling of the cheeks and mouth should improve. For me, I didn't really have much swelling. It just kind of hurt after like the 5th or 6th day. It says a dentist may remove stitches that remain. For me, they gave me like water soluble stitches, so that like they dissolve on their own. 7 to 10 days, that's pretty accurate. Jaw stiffness and soreness should go away after like the first week. It went away, but it kind of came back because I was doing physical like activity, but that went away in a day. And I didn't really get no bruising, so I really can't talk about that. Thankfully, I didn't get none of that. So now let's go over my recovery timeline. So I wrote it in a Google Doc just so I could organize my thoughts a little better. So day one, the day after surgery, that day I felt dizzy because I just got sedated and I just literally got surgery in my mouth. So you're not going to feel like the best that day, but it does get better. Like I said, you're going to have a good amount of bleeding. For me, I didn't have too much pain because if you have a good dentist who knows what they're doing, you're really not going to feel too much. I wrote in all caps to keep the gauze in your mouth. as long as the doctor instructed you, because I didn't follow those orders. I really should have. I may have got a dry socket, but thankfully I didn't. And I just put the gauze in for a couple hours and that fixed it. I wrote in like in big caps, do not drink from a straw because you might get a jaw socket from that. Like the suction from the straw might pull the blood clot out, and that's gonna expose your nerve to like pure air, and I heard that hurts pretty bad. And then on day two, the bleeding continued a little bit. The bleeding continued a little bit, but I used gauze correctly, so it wasn't as bad. It was just like a little bit mixed with saliva. So on day two, I still couldn't sleep, and like I said, I had a lot of saliva mixed with blood. I didn't eat, but they tell you after the first day to start like rinsing with salt water. I wrote very lightly, so I would literally put the salt water in my mouth. I wouldn't even like swish it at all. I would just let it stay in there until my head back, and then just spit it out. So on this, I had so much saliva. I feel like I was like gonna like choke on my own saliva if I didn't like spit it out. So I called my dentist, and they told me not to spit it out, but to like swallow it. They said it's completely normal. When the mouth is healing, you're gonna have a lot of saliva. So I had a lot of it. On day three, like the bleeding almost completely stopped. I ate the first like food since the surgery. I had like little, I think it's called Shinobi yogurt. I love it normally, but I didn't even get to finish it. I ate like half. I continued my saltwater rinses. Like you're supposed to do it twice a day. I didn't like at 8 in the morning before like I got my day started, and then like 8 p.m. And then I played Pokemon Legends Arceus. I wrote shout out Micah. Micah's my coworker. He let me borrow the game, and that game helped me a lot because it gave me something to do. And then I wrote pro tip: if you keep your head on an elevated surface, it helps you not to drool as much. So I did this. I was on my couch and like I put my head like on the hand rest, and I just had my switch and I would just play Pokemon Legends Arceus. And then I remember I watched Moonfall this day and I love the movie. So I'm a big fan of like space and science fiction. So this day I just watched Moonfall. So it was cool. It was a really good movie. And while you're doing all this, remember like don't do anything too physical. Just take your time. Like watch movies, play games. Don't do like any physical because that can actually give you like a dry socket. And then day four, I didn't have as much progress as day three. I did finish my yogurt on this day, and then I had like a clever idea. I got muffins. I crushed them up, and I like put milk in there so they were soft. And this day I got like the first piece of food stuck in my extraction, and I thought like the world was gonna end because I wasn't gonna be able to get it out. That's what like the rinsing in salt water is for. That takes most of the food out. I realized it's not that serious. Just rinse when you're done. I played more Pokemon. Got me a pretty decent team that day. And then day five, my stitches started to fall off, and I got pretty scared because I felt something in my teeth, and I almost took it out by force. So I thought I was gonna get a dry socket because my jaw hurt. But I heard like getting a dry socket is only like a 3% chance. That's when like the blood cut comes out and like it exposes your nerve to the air and it hurts a lot. And today I took my first painkiller. In the day of the surgery up to day five, I had taken no painkillers. I really don't like messing with like drugs at all, even if they're prescribed. So I was issued 800 milligrams of ibuprofen and codeine. So I hear like a lot of rap songs where they're like sipping on lean and all that. That's codeine. Like I said, I don't touch drugs. I don't touch like any kinds of drugs because I feel I'll get addicted. So I just took my ibuprofen. I did more of the same thing. I eat my yogurt and my muffins. I rinse my mouth twice a day, like always, 8 a.m. and 8 p.m. And then I play more Pokemon. And day six, I remember my little sister wanted to go to McDonald's, and I was hungry, right? So I took her and a friend to McDonald's. We got some milkshakes, and then today I ate my first like solid food. It was one French fry, and I was like so happy because I haven't ate solid food in so long. And today I didn't have as much saliva in my mouth, and it didn't hurt as much anymore. I kept rinsing like twice a day. Oh, I forgot to put this in. So I live in California. I think day five, I finally got out the house because Cam Weiler came through. He's a basketball YouTuber. I love basketball, so I went out to go see him. Like we did a park takeover. That's where like people surround the park and they just play basketball with all the YouTubers. So I feel like that helped me a little bit because I got out the house and I had fun. So that helped me a little bit. That happened day five. Shout out Cam Weiler. You probably won't see this, but shout out. And then on day seven, another like one weekend, I said I had another major win because I wrote I was hangry. This is when you're mad and hungry. I was only eating like yogurt and muffins and applesauce. And today I like got out of my comfort zone. I went to Burger King and I got me a cheeseburger. And I got my sister a cheeseburger and some fries and I had a couple of her fries. So I thought that was a win because I finally got to eat solid food. Day eight, I returned back to work. I work part time while I go to college, and like the pain started to come back. And I realized the pain was coming back because this is like the first time I was being active. And Like I said, I iced my face on my breaks and my lunches, and I was able to finish the day. That was another win. And then over time, like the pain went away when I worked. Oh, another tip: try not to sneeze like on the first maybe week, cause like that might like mess up your blood clot. I would like hold my nose so I wouldn't sneeze. And then one more thing, which is current today, I have no pain. The holes are still not closed, and food still gets stuck in there all the time. I use water. I just rinse it out. Like I said, I could eat almost anything through. I could eat almost anything, except for like the things I couldn't eat with because of my braces. I don't eat, but everything else I could pretty much eat. And like you got this, you could do this. Everyone who did it got through it, and you could do this too. We're not special. I had 8 teeth pulled, so if you're just getting 4 wisdom teeth pulled, you got this. You'll get through this. Just have faith. Do what the dentist tells you, and you'll get through this. You probably won't get a dry socket. Hell, I didn't follow what the dentist told me, and I didn't even get a dry socket. So you can get through this. And now we're gonna be reacting to a video of a dry socket. So when I first got my wisdom teeth pulled, this is what I feared so much. I prayed to God that I wouldn't get this. And let's actually see what it actually is. I talked about it briefly.
Hi, I'm Dr. Schessel with Oral Surgery Specialists at Atlanta. And today I want to give you some information on dry sockets, as well as to clear up some of the misinformation that we've seen online. Let's start by talking about what a dry socket is. A dry socket is technically known as alveolar osteitis. And when you break down that medical jargon, it literally means an inflammation of the tooth socket. Dry sockets can occur following any tooth extraction, but they almost exclusively are limited to removal of teeth in the lower jaw. Although they may be one of the primary concerns our patients may have leading up to surgery, the good news is that dry sockets are not actually all that common. Dr. Aiken and myself estimate that we see dry sockets.
They're saying less than 10%, but I've seen like a stat saying less than 5%, and I've seen a stat saying less than 3%. As long as you follow what the dentist tells you, you probably won't get it.
In less than 10% of our surgery patients. The most common misconceptions we see are that people confuse normal postoperative healing with a dry socket. A lot of times people get concerned over the first day or two.
That's true. Like my teeth were healing normally, and I thought I was getting a dry socket. I had any pain, and I thought I was getting a dry socket. You probably won't get it, but it's good to know that it's there, so you follow your dentist instructions.
And they think that the blood clot may have fallen out. But it's important to remember that the process leading to a dry socket usually occurs down deep within the wound, where you can't readily see it by looking into your mouth. Also, a normal healing extraction site will often look gray or yellowish in color, but this is no cause for concern. Let's spin.
Yeah, like I was saying, my teeth were healing normally, extremely well, and they were yellow, and I thought, oh no, my blood clot fell out. Let me call my dentist.
A moment discussing some of the signs of a dry socket and what you should look out for. A dry socket typically presents about 3 to 5 days after a tooth extraction has occurred. One of the classic signs is that patients tend to experience a throbbing, painful sensation that radiates to either their temple or to their ear. Mild cases will usually respond well to 600 to 800 milligrams of ibuprofen. However, if the discomfort does not subside with oral pain medication alone, a dry socket is easily treated in the office with the application of a special medicated packing. The good news is that these cases usually get better after 1 or 2 post-op visits, or really just a few days. So there you have it. I hope this video was helpful in answering some of your questions regarding dry.
Like I said, this was my major concern, and it wasn't even that big of a deal. Like, if you say you do get it, and what's the worst thing to happen? It's gonna hurt a lot, but you're gonna just go into your dentist. And like, not many people do get it, you know? Like, I was scared. I was like worried the whole time that I was gonna get it, but everything was healing properly, and everything worked out. Here are the symptoms. You're gonna have pain, partial loss of the blood socket, a visual bone, pain to your ear and to your temple. I was having pain like in my neck, so I thought I had it, but no. Another big another big symptom was bad breath. So I was like nervous. I would tell my little sister to come here, and I would like breathe on her face. Like I would ask her, does my breath smell bad? Because I thought I was gonna get a dry socket. And then an unpleasant taste in your mouth. You might get this because like you literally have blood in your mouth, and you really can't brush your teeth too well. So, like I said, dry socket. It's not a major concern. It's there. Just follow what your dentist tells you. Try not to smoke, drink out of a straw. Try not to sneeze or like to lift heavy, and then you really shouldn't get it. And that was pretty much it. If you enjoyed this video, leave a like and subscribe. I just wanted to make it because like I didn't really see like a comprehensive guide to like getting your teeth pulled, and I wanted to like put everything together in one video.